Why, Mr Abbott, do you force general practitioners into a position where they have to have a conversation with their patients, not about what's wrong with them, but about what the size of their bank balance is? Why, Mr Abbott, are you so determined that even after you've lost your first attempt at a co-payment, you introduce a second Plan B, which is a co-payment by another name? Why, Mr Abbott, do you not recognise that this isn't just a barnacle, it's a hole in your boat and it's going to sink your boat? There has to be a reason. That reason cannot be that Medicare is unaffordable. It cannot be so, because our system of public health care is one of the most effective and one of the cheapest in the world. Whereas the United States, the model that the Liberals and Nationals at the state and federal level want to take us to, in the United States, healthcare eats up an unaffordable 20% of their gross domestic product. In Australia, it's less than 9% of the gross domestic product. We do it for less than half the cost, and we do it twice as well. And we do it that way because we have people going to GPs, and those GPs are affordable, they are accessible, they are available, and they take the pressure off the healthcare system. It cannot be because there is a genuine crisis in our healthcare system, because there is no such crisis. If indeed there is going to be any growth in our healthcare costs, it'll be from about 9% to 9.4% over the next 10 years. That's not a crisis, that just recognises that what is happening to us is that we are getting a bit older with slightly higher healthcare costs. You can't make a crisis out of 0.4% of the gross domestic product. Not even Tony Abbott can manufacture a crisis out of such a relatively minor amount of money. So why, Mr Abbott? Well, I'll tell you, I reckon I know why, and it's the same reason why Mr Baird and his Health Minister Gillian Skinner are busy trying to privatise our public hospitals. It's the same reason why Mr Baird is trying to destroy our TAFE system and privatise that. And it's this: those members of the Liberal Party and the National Party look at Medicare, they look at our public hospital system, they look at our TAFE system, and they are embarrassed, because their ideology, that private is always better than public, their ideology, that is always better to do things through a market than through public provision, their ideology of deregulation, their ideology of feeding private profits, fails when it comes to healthcare, fails when it comes to education, fails when it comes to transport, fails when it comes to human services. This is a campaign not just for Medicare at the federal level. It is a campaign for the very heart and soul of Australia. It is a campaign for that part of Australia that says it doesn't matter whether you're wealthy or you're poor, you get access to your GP before you get so sick you have to end up in a hospital. This is a campaign that says no matter what background you come from, whether you're a working Australian or you're the son of a stockbroker, you get the best possible education at a TAFE or a public school. This is a campaign that says if you've got a disability, you will have the choice of a public sector provider. This is a campaign about who we are as Australians. Like John Robertson, I'm proud to stand here today with the Nurses and Midwives Association of New South Wales. Sorry, Brett. The New South Wales Nurses and Midwives Association. I'm proud to stand here with progressive people from across the spectrum. I'm proud to stand here and say that in the Senate, as soon as it sits next, the Greens, Richard Di Natale, Senator Di Natale, our health spokesperson, will move a disallowance motion on this to stop it happening. But this isn't going to be won or lost in the Senate. You know that. It's not even going to be won and lost in the big house across Martin Place. It's going to be won here in the streets. It's being won by the nurses and the midwives around Australia, saying this is bad news for us. It's going to be won by everybody having the conversation and saying very loudly, Medicare, TAFE, public sector delivery of aged care and disability care, public sector delivery of transport, public hospitals are part of what make us a civilised society, make us a successful society, and we will not let the Liberals or the Nationals or anybody else destroy them because they're an embarrassment to their neoliberal ideology. Thank you so much for listening.